Oh, we are rolling.
Do
Okay.
you need betadine?
Do you need betadine, doctor? We have Dr. Appy today. She's not really a doctor, but she's training to be a nurse practitioner. She's a student. How you doing, Appy?
Good.
We have our patient, Thorny. Hey, Thorny, how are ya?
I'm here.
You like that nickname?
That's fine.
You got something strange going on with your left leg. That's what's in the video right now. Tell us what happened.
My picture frame fell.
Now, did you just have a gust of gravity of some kind, or did somebody move it?
No, I picked it up and moved it,
Aha!
and it tilted over. Hit my
Slipped
leg.
out and got your leg. How many days ago was that?
The day or, a couple of days after I was in here last week. That's been a week and a half.
You had a bronchitis, didn't you?
Yes, sir.
Okay. So you came back in because you've got this big bump on your leg. Does it hurt much?
Well, not a whole bunch.
Not a whole bunch. Well, what happened was you bumped it and you got a little blood under the skin that has now clotted. So you have a clotted hematoma, and we've asked our friend Appy to help Gumby Jean and I remove this for you.
Good.
And you're okay if we video your procedure for all our friends around the world? We're going to beam it to outer space and everything.
Oh, yeah.
Okay. All right, Appy, are you ready?
I am ready.
I am here to be your assistant
Okay.
and the camera operator.
Okay.
Gumby Jean,
Yes.
what do
sir.
you know? We haven't done a video in a little while, have we?
A couple weeks ago.
A couple of weeks ago. A little alcohol swab first, okay? Okay. Now, if you feel any pain, you're going to let us know. Now, of course, we are going to have to give you a little anesthesia, just a little tiny baby shot, okay?
That's fine.
Is that going to be all right? I think you'll do just fantastic.
Okay.
With a nickname like Thorny, we know you're tough.
Yes, I am.
Yes, you are.
Okay. And should go ahead.
I'm real proud of you for not letting your husband use that pocket knife to do this for you.
To open it. I'm sure he thought about
You're
it.
going to feel a little cold right now. That's
Well,
Dr.
I
Abby.
got my surgical knife.
Light it on fire.
No, I ain't got.
There we go.
Or some.
I got a box
Some vodka.
about like that. It's got all kinds of knives in it.
Well, I'd love to see those knives. I kind of like some knives
He
too.
said he was going to get that surgical knife after you.
Well, I'm not going to let that.
Stick it in some vodka. And he thought about it.
Okay.
So that's a little betadine, right?
Mm-hmm.
Okay. And Appy's a camera blocker, I can see already. That's okay. Don't you worry about the camera. You take care of Thorny here. She's our delightful patient. You want to tell everybody how old you are?
Sure.
Tell him don't start no mess.
Sure. 87.
32. 87, okay. All right, the next thing we're going to do is we're going to have to administer a little local anesthesia. Now, we've got two things that are going to happen here, okay? Are you ready? Let me tell you what's going to happen. The first thing is Gumby Jean there's got a really cold spray. She's going to spray right on that. And then Appy, Dr. Appy here, is going to do an injection with the world's smallest needle to numb up that skin right over the clot. Are you with us?
Yes.
We're not going to do anything till we tell you. Are you ready?
Okay, where we
So
going?
here, so I'm gonna go to the side or
I think just right across the top.
Right across the top?
Right across
Oh,
the
okay.
middle, yep. All right, here comes the cold spray from Gumby Jean. There we go. And here comes a little injection. There we go, wonderful.
little hook.
Little injection by Dr. Appy.
You okay, honey?
I'm fine.
Okay.
Oh, ever so quiet. It's a beautiful injection, my friends. Just the slightest blanching of the
Get
skin.
it dead enough, you can take that leg off.
We don't want to take that leg off at the knee. That's just mean.
Be nice.
You may want to give her
Till I-
a little bit more.
Wait till I get you
Oh,
home.
did you use it all up? Okay. You're probably going to get a whooping when you get home now.
Yeah.
Okay, we're going to take a break and let her get a little bit more medicine because we use it all up in one spot, and we're going to have to make this incision a little bit wider.
So another.
There we go. So we're going. So what you
Yeah,
want to do?
you-
Yeah, we want to come.
Work around it.
You can, or in this case, this skin is really, really thin, okay? As we get older, our skin gets thinner and we're more prone to having these kind of things happen. But I would just go right across the top, and then when you make your incision, you'll just go across two. Then you'll open it up and basically you just make one little squeeze and you'll be able to get that clot to pop right out of there. And then we just put a little pressure on it, we do a wrap, and that's all this is gonna need. You won't need any stitches or sutures or any kind of anything like that. Just a dressing and a little pressure wrap on there for a day or so. Okay?
In this area?
Okay, we're rolling again. Let's get the rest of that. Here comes the cold spray again, Thorny.
Okay, Doc.
There you go. Okay, get right in there and work your way a little further north, superiorly. I want to be sure that we get lots of pain medicine in there because we don't want to hurt Thorny.
I'm gonna go just a little more up.
Oh, I'm sorry. I'm freezing her fingers off.
Okay.
That's okay, they'll grow back. There you go. She's very gentle. Go ahead and squeeze some medicine in there. There we go. I like that. That should be enough. Perfect.
Sorry.
Perfect. Okay. How was that? Did that hurt a lot getting the numbing medicine?
No, just burn a little.
Just a little stick sting and a burn?
Yeah.
Yeah, okay. All right, I think we're ready now. It works fast, and that's super thin skin there, so this should be really easy. You're going to make about 1.5 inch incision, 1.5 inch long incision. Don't take it off that way, you can cut yourself. There you go, now you got it. Okay.
Okay.
Okay, now, you don't want to use it like a butter knife.
Okay, so
The best way for me to do this is to show you.
show me.
Okay, so what you want to do is you want to take it like this, or like a pencil.
Okay.
Okay, there you go. And you only want to go about 1/4 inch deep. There you go. A little more of an angle. Come up a little bit more. There you go. Now she's not going to hurt. You numbed her up. She's going to be fine. Put a little more pressure. Okay, okay, okay. All right, all right. Welcome to
I'll
Welcome.
get that later.
welcome to Splashtown. Well, it seems like it wasn't all clotted. It seems like there was some blood under pressure in there.
Well, let me
It's
tell you,
itch.
right after she bit
This
me,
one shot.
Yeah.
it was bigger than that.
I'll bet it was. Go ahead and continue with the incision a little bit. Oh, see, it's already come down some. We want to be able to get, there's some clot that's in there too. We want to be sure we get it all out. So there you go. I'm
you
proud
see
of you,
that?
Appy. You did a
Yeah, I
nice
saw
job.
that.
Now you're nervous, aren't you? What else is going to jump out of it?
trying to.
I knew
See where I
something
need
went
to get
right
You got, you got blood on the wall over there.
That's
That's all right,
okay.
I'll get it.
We'll get that taken care of. No need to be concerned. There you just get right in there. See, now you know why I'm further back here now.
Uh-huh.
This ain't my first rodeo. So just go
Guns when I used to
little bit-
run.
a little bit deeper. Okay, now there,
There
you
we go.
There you
There
go. That's
we
actually
go.
a lot of clot. Now what I would do at this point is just carefully put down your sharp, put down your number 11 blade in a place where you won't jab yourself.
Yeah.
Okay. And
Wanna
then
see it?
there you
No,
go.
I don't want to see it.
Use 2 of those, and then squeeze them together. There you go. Let us see what you get out of there. Oh yeah, look at that. Are you having any pain at all, Thorny?
No.
No. Get that out of there, because if you don't, that'll thicken up and she'll be stuck with it and she won't be real happy. Then she
You
won't
got a
come
brand
back.
new leg over there.
Then she won't come back later and bring me a
Back to
birthday
normal.
present or anything. That wouldn't be any fun.
Your birthday's in 2 weeks.
Couple of weeks, just like every year. Seems like every year it happens
You
about.
get
the same.
older, right? Every
I
year?
know, every year.
The older you get, the faster the years goes by, buddy.
I think that may be true.
I'm almost 27.
You're almost 27.
Get that clot, good. Get that clot out
Stop
of
complaining.
You okay?
Yeah.
You're not hurting her. You would tell us if you were having any pain, wouldn't you?
Yeah.
There you go. Look at that. Now you got all the juice out of there and most of the grape
It's
jelly
just very
too.
little.
Why don't you push on the top up there a little bit and see if
And
anything
she
comes
was
that
gonna
direction.
tell me that when they clean it and all
Yeah.
later, to not use,
Can they use hydrogen peroxide?
You can use a little peroxide flush. Do you want a little peroxide on a gauze? I can do that for you. Here's some peroxide on a gauze. You can take that and just kind of clean it up. And really, I think that's very good right there. What you got coming out of there? Anything interesting? It's just a little tissue. If you don't mind, let me just give it a good feel. I want to make sure that I'm happy with it too.
You know, when it did go from the top down, it did have some.
That's okay. You're fine.
Little
A
clot
little
there.
bit in there. Just a little bit more. Okay, Gumby Jean. We are in good shape here.
Okay.
Let's put a dressing on this and then a nice little wrap around it to hold everything in place. Thorny, you were just awesome. I think that's going to heal perfectly for you now. Okay. Thanks for letting us video your procedure.
Thank you.
Bye. I took my Meta 7.
Okay, tell us your experience with Meta 7.
There's no doubt that it's a benefit to me. It gives me more stamina. If I miss a day, there's no doubt I lose energy earlier in the day, and I won't go without it in the future,
It's fantastic. So you really noticed a surge.
without a doubt.
How long did you have to take it before you noticed a difference?
Probably a week to 2 weeks. I was really feeling the difference in my day.
Right, yeah, it took me about 13 days before I noticed it too. Awesome. Well, we appreciate you letting everybody know. Thanks.